had just 10 days to prepare for my exam because I didn't get my eligibility certificate or anything. So just from January 1st till January 12th, which is the exam date, that's when I prepared. So the thing is like because sir and him a couple other sirs like Omba sir, they all gave us really good advices. So the plan which Vikas sir gave, that was what I was following for the last 10 days. And the tips which sir gave was what helped me in the preparation phase totally. Because we just have to focus on our strong suits. We shouldn't like try to cover up everything in one go. So like I'm good at clinical stuff, so that's what I focus mainly on. That's why the second paper was good for me. So the first paper, like I didn't know literally anything. So that is the reason why, whichever is a strong suit, we have to go for that. We have to focus on that. So if you're not able to memorize or mug up anything, just leave it. That's what I'd say. If you're able to like keep it in your mind for a long period of time, then that's good. That's very much good. That's
So,
what I say.
since you did like preparation within 10 days, right? I have one question I wanted to answer. What is that? Not about the subject, but about love. Okay. So, did you do any grand test or you just walked in with the car? Tell the honest truth.
I actually did the grand test from AFN.
Okay, you did. Okay. But did you pass the grand test?
No.
Okay.
No.
But did it affect your final result?
No.
That's a live testimony. I wanted to tell you about the grand test. Okay. That's not the final thing. Okay. Then next important aspect only question solving is important or only rapid revision is important or notes of some subjects also is important.
Notes are important.
Notes are important. Okay. So anything if you guys wanna ask him, ask him. Okay. So last 10 days, how did you remember the things, especially from my subject?
Actually, the funny part is I wasn't present for the pharmacology, but I was present for the radiology and the biochemistry one. Even though there were much of what came, but other than that, he integrated a lot of stuff with the other stuff, which really helped me in a lot of the aspects, lot of subjects.
So according to you, learning the subject as it is better, or when you are trying to correlate and learn, and is it better to learn clinically or is it better to learn just remember the drug of choice?
It's
No,
better to
tell
learn
the honest opinion, okay? Just because I am here and asking, you should not tell anything different.
clinically and correlating with everything. The best thing which I would say is relate to yourself. Just put yourself in the patient's point of view and think of yourself as a subject. That itself will be the best thing.
Okay. So congratulations. Okay, I am not asking marks
No.
definitely. Okay. So see, now the marks does not matter, does it?
No.
Exactly. Okay. So what you have to do is pass the exam. Okay, and keep the confidence and regularity. Consistency is very important. Okay, I'm very proud of you to say that you are my student. Okay, so congratulations. So from my side.